Overall comprehension of the condition of your mental, physical, psychological, and sexual well-being is what the objective of a health assessment is meant to achieve. Screening for a variety of disorders and taking preventative measures to improve your health are both possible thanks to health exams. What is the purpose of a health assessment? An individual goes through a series of diagnostic procedures and checks in order to get their health evaluated. This is what is meant by the term health assessment. They can be requested by an employer to evaluate a person's fitness to do a job, or they can be ordered at a specific age group to give an indication of a person's state of health and highlight any necessary interventions that need to be made. In either case, the purpose of the evaluation is to determine whether or not the person is able to perform the duties of the job. When it comes to workplace evaluations, you are able to put in a request for one either before beginning a new job or when there are changes made to the job description for the one you already have. Importance of having your health assessed on a regular basis. It has been predicted that if people gave up smoking, maintained a healthy diet, and engaged in regular physical activity, they might prevent 40% of deaths caused by cancer and 80% of deaths caused by type 2 diabetes, cardiovascular disease, and stroke. Not only are diseases that are preventable to blame for the deaths of thousands of people every year, but they are also to blame for the loss of valuable time and resources. This waste of time and resources can be quantified in terms of the amount of time lost from work as well as the costs that are incurred as a result of treating the disorders. Your healthcare practitioner will be able to lead you through the development of a management strategy based on the results of the assessment, which may include the following. Observe a balanced diet and engage in frequent physical activity. Medication is taken with the hope of avoiding the emergence of an existing chronic condition. Medication for chronic diseases can help you better manage your health in the event that you have a chronic disease. What can you expect during your health assessment? Your age group will determine which screening tests are appropriate for you to take part in. In addition to examinations tailored to your age group, you should anticipate the following. Recent developments in medical history. Your doctor will review your medical history and ask you questions about any new symptoms or health concerns you may be having at the time of your appointment. Measurements. You are going to be weighed and measured, and all of this information is going to be added to your file. Your heart rate and blood pressure will also be measured and recorded for your medical file, where they will be compared to any previous readings. Medications. Your healthcare provider will inquire about any medications you are currently taking and check to see if you have been adhering to the recommended dosage and frequency. Instruction in healthcare. Your evaluation will also include some health education. During this portion of the process, your practitioner will provide you with feedback regarding your food, weight, and exercise levels, highlighting areas in which you can improve. Who should have a health assessment? Children's health assessments. Children who are eligible for the Health Kids Check are those who have reached the age of 3 but have not yet reached the age of 5, and who are currently participating in the National Immunization Program for children. Adults aged 40 to 49. Type 2 diabetes evaluations. An evaluation of the risk of developing type 2 diabetes should be done every 3 years on adults who are between the ages of 40 and 49. The objective of this test is to determine how likely it is that you may develop type 2 diabetes in the future. Should the examination reveal that you are at an increased risk of developing diabetes, your healthcare practitioner will provide you with lifestyle recommendations to help you improve your eating habits and the amount of physical activity you get. Check out our piece about the finest treadmills for home use if you have diabetes. It will help you keep in shape even when you're stuck inside. Chronic disease assessments. An evaluation of your risk of developing chronic diseases such as heart disease, diabetes, and hypertension should also be done if you are an adult between the ages of 40 and 49. People who have mental retardation or intellectual disability. On a yearly basis, assessments of the health hazards faced by individuals with intellectual disabilities should be carried out. People over the age of 75. When a person reaches the age of 75, they are eligible to obtain an annual health assessment. Personal health assessments help individuals get involved with health coaching. When a periodic health assessment is administered, individuals have the chance to opt in to health coaching or counseling. When an individual completes a personal health evaluation, they are asked, if there is a health concern or risk, please contact me. A question like this allows the individual to identify in the evaluation if they are interested in a health behavior change initiative. When an individual opts in, the doctor or a third-party provider can contact them to enroll them in a behavior change program. So, that's it for today's video. What do you think of our video? Hit us up in the comments and let's chat. Don't forget to like, subscribe, and turn on the notifications for our channel so you never miss what's coming next from us. Thanks for watching.